Gaza's health ministry, which is run by Hamas, says at least 24 people have been killed while waiting to receive aid in Rafah. The Israel Defense Forces confirmed it fired shots near what they call a few individual suspects who were accused of advancing towards Israeli soldiers. They say they are investigating.
Well, Nasser Hospital in Gaza is one of the last functioning medical facilities, and a team of British doctors is working there, and they say the situation has become desperate with supplies scarce.
One of the doctors working in Rafah is Goher Rahbour, a consultant surgeon from London, and he joins us now. Good morning. Thanks so much for taking the time to join us. How are things there at the moment?
Hi there, morning. Thanks for having me. We could talk about the mass casualty event which occurred on Sunday, but the whole situation here is very, very desperate. You've had guests before, but just generally the situation with antibiotics and swabs, muscle relaxants, there's just a complete lack of everything. But happy to talk about the mass casualty events which took place on Sunday, of which there was two.
Doctor, can you just give us an insight? This might sound a bit strange, I don't know, but how are you and your team coping in this situation? How are you looking after each other?
The team and other colleagues, we're doing fine. What is actually really, really remarkable is the strength of the Gaza Palestinian doctors, healthcare, who've suffered for 19 months. It is absolutely phenomenal how they function. And I'll give you an example. So in the mass casualty event, one of the consultants who was operating with, his cousin had actually gone to the food distribution center, had been shot, had been killed. This consultant buried him on the Sunday and then came to work. So, you can put my side and other colleagues, but the Gaza doctors and the healthcare workers, it's just phenomenal. It's unprecedented. I have full admiration for them.
You're there, we're not. Israel won't allow independent foreign journalists into Gaza to see for ourselves what is going on. So, of course, we have to take our information from other places. I'm keen to ask you, Goher, what you see of Hamas. The Israel Defense Forces argue that they are attacking Hamas, who are hiding in places or beneath places like hospitals. They talk about the tunnels under Gaza, and Hamas, as we know, still has a large presence and a large influence over the Strip. What do you see of them?
Zero, absolutely zero. So I'm here for a month. I've been here 2 weeks. You go around the hospital and absolutely zero. What we're seeing is kids. So from the mass casualties, for example, in the afternoon, that comes along. And in the evening, you go into resus, you see a little girl who's about, that big, and her foot's hanging off about a meter away. The second person you see in resus is another kid who's got their leg cut off at the knee. The third one is another kid who's had shrapnel in the front of their chest and at the back of their chest. And you see these are the type of patients, kids, women, everyone that's there.
Yeah.
You don't see, I've not seen any Hamas or anything like this. This is just simple, innocent people. And you can walk around the hospital. There's no issue. I've not been stopped or I've not seen anything. You can go anywhere you want.
Yeah, the situation remains utterly desperate. The hope, of course, is that there is some sort of agreement between Hamas and Israel's government to pause what's going on. You may not see them, but I'm sure you speak to Palestinians who hope for the same thing. What do they say to you?
We don't talk about politics on this. We're here as a medical mission. You're as a doctor. You treat the patients, and that's primarily the focus of my role here. So we're keeping the politics side of things out. Yes, and purely focused on the clinical side of things. And I can talk about some of the examples which happened sorry to interrupt there, but there was a couple of the cases which came in and I operated on Sunday. Two of those had bullets which had gone through the left side of their abdomen and involved lots of bowel loops and so forth. We operated on them, and at the time of the operations, the second case, the bullet that was removed, it's quite interesting how the colleagues in theatre mentioned it's an M16 bullet. I don't know anything about guns or bullets. And then yesterday, when I followed up two of those patients who both had gone to the safe distribution center, they told me who had shot them and the type of bullets and so forth. So that was all very interesting.
And Doctor, in the last sort of 24 hours or so, we've been hearing news of shots fired at a distribution centre, people giving out aid. Have you heard anything about that at all?
Yes, so on Sunday, the mass casualty started at 7:45 a.m. I went to theatres. The two people, as I say, the first two I operated on, the first was a 22-year-old male, the second was a 20-year-old male. Both similar injuries from the left side of their abdomen and bullets that we took out from within the abdomen. Yesterday, as a follow-up, the first patient who I spoke to, he's obviously recovering from major surgery. He said he had gone to the food distribution center, which is part of a safe zone, and he had obtained some food. When he left, then he was shot on. And like you're asking me these open questions, I also put to him, what was the event and who shot you? And he said the bullets came from the tanks. So soldiers who lifted themselves from the tanks and then fired. So for him, he was in a group of four. One of them died. He himself and the other two laid on the floor for 1.5 hours before they could be taken away. And did anyone, come to help you from a military point of view? Zero. The second guy, who is 20 years, he had gone to the same place and said that by the time he arrived, everything had already gone. He was fired upon by either American contractors or American military, but these were not penetrative injuries. It was more to do with the dispersion thing. When he left the compound, that's when he was fired upon. Again, question, who did the firing? In his words, IDF. And it was interesting, he said the same thing, M16 bullets. I was like, wow. And I asked these questions. It's part of the hospital. There's family members, there's no coercion. It's a very calm situation. They're obviously recovering from emergency surgery.
Yeah, I was gonna say, you obviously asked those questions to find out the state of the injuries and how it was caused. Goher Rahbour, we really appreciate you taking the time out to join us from what is an unimaginably difficult situation for you there.
Yes,
Thanks so much.
Thanks a lot.